It is amazing. I don't think it's really sunk in yet. To get this Honorary Fellowship, I don't think it's really sunk in for me as yet. I'm incredibly grateful for the governors here, for Professor Ruth Edwards in particular, and the Vice-Chancellor to award me this. I'm very grateful. I must admit, when the news landed, when that letter came in, I was bowled over. I think I read it about 15 times just to get my head around it, to be honest with you. I wasn't sure what to make of it, and I remember phoning up a friend of mine saying, what does this mean? This is landed here. What does Honorary Fellowship mean? So you don't pursue your career to get such honours like this, but when they land, you think it's wonderful that there's someone out there looking at what you've done, what you've achieved, and recognising that, and it's such a wonderful thing from the University of Wolverhampton. So in terms of my links and my career with the Black Country and Wolverhampton in particular, I've been working in the NHS for over 20 years now, and most of my career has been working in Wolverhampton or around the Black Country. And my role today is focused on improving the outcomes for our population in Wolverhampton, and I'm very privileged about that. So working in a fantastic medicines directorate within the Black Country ICB, and in particular working with pharmacists and pharmacy professionals across the entirety of the Black Country to ensure that we get the very best out of the individuals, but also to make sure we maximise our benefits for our patients and our citizens. Yeah, working for over 20 years in this profession, you have to be very resilient. I mean, that's a cornerstone of most careers, I think, but more so, I think, in the pharmacy profession over the last 20 years or so. So being resilient, being absolutely determined. There are going to be knocks and bumps in the road, I always say that, but you've got to keep your aims, your aspirations, your vision in line, so you know which way you're going and the right path you're going to. So I'm always keen on ensuring that the next generation are able to have that level of determination, know that there are going to be challenges, but if you keep your vision in sight and know that there are going to be these bumps in the road, you'll have to be resilient, you'll get there. Hard work is key for me. I'm quite fortunate, and I've been fortunate to do some lecturing at this university for the pharmacy degree, so thinking about those undergraduates climbing that ladder and getting there, graduating today. I think the key thing for me has always been looking forward. So they should really enjoy today, grasp everything today that they've got and celebrate it well, but start thinking from tomorrow, what next? What next am I aspiring to do, and how will I get there? What do I need to do to get to that next step? Not to rest on one's laurels at the moment. That's the key thing for me. Have that aspiration, make sure it's clear in terms of what your goal is, and work very hard to get there.